North Carolina statutes to consider. S.7B-3400 Minors Consent Law. Persons under the age of 18 are considered to be minors. Minors are subjected to supervision and control of their parents when determining consent to medical treatment. Given that Matthew is only 11 years old, he's considered to be a minor in the state of North Carolina. Because of this, Matthew is subject to the control and supervision of his parents when it comes to providing consent for medical treatment. G.S.90-21.5 Minors consent sufficient for certain medical health services. Any minor may give effective consent to a physician licensed to practice medicine in North Carolina for medical health services for prevention, diagnosis, and treatment of vulnerable disease and other diseases reportable under G.S. 130A-135, pregnancy, abuse of controlled substance or alcohol, and emotional disturbance. Under this North Carolina general statute, Matthew should be able to request mental health services for himself as long as he has the decision capacity to consent. Alternate solutions. Option A. Mary could work with Matthew during private sessions, teaching him skills to use to become more successful in school. Mary would need to do a little research, seek out other colleagues, preferably a colleague that has a background working with special needs children, and her supervisor to gain a deeper understanding on how to give Matthew some skills he can use in school. Option B. Mary could find some resources for Matthew's parents that are a little more detailed in nature to Matthew's condition in hopes that clients' parents would be more educated and agree to Mary's request for Matthew. Option C. Mary could invite Matthew's parents in on some sort of sessions with Matthew was okay with this option. This could help Matthew's parents trust Mary and her professional opinion. This may also be a way to educate the parents a little more on how to care for Matthew. Option A, B, or C. We think that combining all three of these options would be a benefit to Matthew. The consequences of these actions would be that Matthew would develop skills to use in the classroom setting to improve his overall performance as a student. His parents would become more educated and hopefully become more supportive of Mary and her professional opinions. Both Matthew and his parents would become more educated on how to care for the client. Or references. And our 5-question quiz. If you were Matthew's counselor, would you approach the situation with his parents in the same manner as Mary? Why or why not? How different would this case study be if Mary was a school counselor at Matthew's school? What professional impact will Mary's position have on her role as a clinical mental health counselor? In what other ways could Mary advocate for her client? Does Matthew's parents' wish for privacy take precedent over what may be best for Matthew in terms of his mental health treatment?